Welcome to the Supervisor Talk podcast. The purpose of this podcast is to showcase research being done by the KHS faculty members through questions asked by the supervisor's student. My name is Flavia Rusterholz, and I am a PhD student under the supervision of Dr. Darren Candow.
Hi, everybody. As Flavia just mentioned, I'm Darren Candow, professor here in the Faculty of Kinesiology and Health Studies, primarily in the areas of exercise physiology and sport nutrition.
All right, Dr. Candow, how long have you been working in the Faculty of Kinesiology and Health Studies?
Yes, since 2007. Time certainly flies, so 18 years now, or actually going on 19, yes.
Wow, impressive. What are your main research interests?
The biggest one is the combination of exercise, primarily resistance training, and then a form of nutritional supplementation. The main focus is creatine monohydrate.
And how did you get interested in creatine monohydrate?
It was by accident. I was doing my master's degree at the University of Saskatchewan, about 2 hours north of here, with a non-essential amino acid glutamine. And I was interested in see the effects of this amino acid on body composition. At the same time, I had a colleague doing his PhD with creatine supplementation. So while I was investigating glutamine with resistance training and unfortunately didn't have any beneficial effects, we were starting to see that creatine in combination with exercise was making primarily young males bigger, stronger, faster. So that sparked my interest in what other populations might benefit from that combination. And that's when I sort of pivoted into healthy aging.
Awesome. So what have you been researching in the past year?
So primarily in combination with you, we've been really focusing on low-dose creatine supplementation. We're trying to come up with real-life applications of a dose that we think is realistic and still beneficial in combination with resistance training. But this time, we've looked at weight training and then, of course, a couple other studies. As you know, we're looking at resistance band training. We think that's a very viable alternative to traditional gyms. People can use these at home, traveling. They're very cost effective, and they don't result in any adverse effects. So sort of looking at two therapies, nutrition, primarily creatine supplementation in combination with resistance training to see can it improve performance measures in older adults, body composition, as well as functionality.
Awesome. Sounds very interesting. Can you reveal a few of the main findings?
Yeah, some recent ones have shown that low-dose creatine supplementation without a loading phase. I think for anybody listening, you're familiar with the loading phase, which is 20 grams a day for 5 or 7 days. But we showed that about 3 or 5 grams a day without a loading phase, so a very small amount, probably amount that you would find in a large steak or a salmon steak serving and a half on a daily basis, seemed to improve some measures of body composition, specifically lean mass and skeletal muscle mass, which is huge predictors for longevity. It also had beneficial effects on strength. So I think, the improvement in strength is likely one of the main reasons people can live longer free of disease independently. And then a couple other studies have shown that the timing of creatine supplementation is likely inconsequential. I think the nice thing with creatine is you can take it at any time of the day, whatever's convenient for you, but that's the key. Make sure it's convenient. And I would also suggest to take it on the days that you are not training. So take it on a daily basis. We focus primarily on muscle, but there's other beneficial effects potentially on bone and, of course, the brain.
Yeah, sounds huge. So what does this mean now for practitioners or for the general public, as well as the academic community?
Yeah. It's a great question. We think if you can translate these into practical applications, so for working with older clients or disease state populations, maybe those with arthritis or sarcopenia or osteoporosis, or even a healthy aging adult, the combination of resistance training has to be there, and then the addition of creatine seems to augment or slightly cause a little bit benefit or greater effect. So for those listening, exercise is foundational. And then adding this dietary supplement, which you can get through the diet in red meat, seafood, and a little bit through poultry. But most people are familiar with supplementation. Just a little bit has been shown to have some beneficial effects.
Yeah, that's awesome. Can you talk about a few challenges that you faced during your research?
Yeah, I think ever since COVID, dealing with human research has been very challenging. For whatever reason, a lot of people in the community are a little hesitant to volunteer for volunteering their time for research. And maybe that's because everybody's really, really busy nowadays, or there's a lot of demands on their time. So unfortunately, one of the biggest barriers to participation in exercise is lack of time. And that's is likely explaining why recruiting human subjects has been so challenging. So unfortunately, in our area of research, usually we have low sample sizes, but that still doesn't necessarily mean that those studies are inconsequential. They can provide a valuable contribution to the literature. So especially in the last decade, I've noticed that human research volunteers or getting enough people in the studies is probably the biggest challenge we're starting to see, and likely because of the demands on people's schedule.
Yeah, and it seems like the population you're choosing is not the easiest to work with either.
Yeah, it can be based on limitations of transportation, comorbidities with aging, joint pain, access to different facilities. But the good thing is those people are phenomenal to work with because they're excellent participants. But there are some challenges, just like everybody's experiencing. Yeah.
Absolutely. So what's next? Where do you want your research to go next?
Yeah, it's a great question. I think we're always looking forward. So if I had to look for the next 5-10 years, I think we have a good grasp on the beneficial effects of creatine on skeletal muscle. We have a little bit of information on bone, but I'd really like to look at it from a whole body perspective, still continue to look at different dosages on skeletal muscle, then sort of progress into bone health for especially individuals with osteopenia or osteoporosis. But the big area, I think, is above the neck, cognition. So brain health, memory, cognition. Can it have any application for treating neurological diseases such as dementia and Alzheimer's? So I think that's the area of focus. And then you combine that with trying to really determine the optimal daily dose that seems to check all those boxes. We have a good idea about skeletal muscle, but to be honest, we don't really know the best dose for bone health or especially brain. So it's really good in the next little while to try to determine the optimal dose of creatine that you can do with exercise. Yeah.
Can you kind of reveal what would be best for right now, or what's the best dosage right now above the neck? Yeah,
so above the neck, it's very interesting. It seems at a very, very high dose. So I mentioned earlier on about this loading phase, 20 grams a day for about 5 or 7 days, which is typically adopted by athletes. But that dose has been very effective to increase brain creatine levels and then sort of correlate into positive cognition and memory. I also think that dose is very effective potentially over time. But the downfall with that dose, it can cause some adverse effects such as GI tract irritation or a little bit of water retention. So if you had to ask me in the dose that I take about 10 grams a day on average, which checks off all the boxes for muscle, bone, and the brain right now. Keep in mind, no studies determine that 10 grams or a little bit more is optimal, but it seems that that's a good overall average dose.
Thank you so much for joining in, Dr. Candow. It was very insightful to hear about your research and all your ongoing projects.